So much good energy, so much collaboration, so much creativity happening in this space. It's palpable, right? It's tangible, it's electric. What's going on in the room right now. And we want to continue this conversation. We want to continue the dialogue and continue to expand the prism of what we're here to do and what we're talking about. When we talk about breast cancer, we speak of the patient. We speak of the patient who is out of training, who is out of treatment, who becomes the advocate. We speak of the researcher, the clinician. We speak of pharma. But do we talk about the role of the caregiver, the role of that ecosystem, right, in clinical trial decision making? Do we talk about the role of the nurse and the navigator? And so in an effort to truly be comprehensive today in this work and in this conversation, I would like to initiate this conversation that incorporates both the caregiver, the nurse navigator, the patient lived experience, and a very, very special interview highlighting male breast cancer. But up first is Emily Gentry. Emily is the Senior Director of Education and Program Development at the Academy of Oncology Nurse and Patient Navigators, AONN. And anyone who has worked in oncology and any patient who has navigated the oncology landscape knows how important it is to have compassionate nurses who are able to educate our patients, navigate them, empower them, listen to them, commiserate with them. And so Emily's going to talk with us today about exploring the role of nurse navigators in clinical trial education and accrual. Emily, welcome.
Okay. Thank you so much, and thank you, Dr. Mo. And I am truly inspired. I know we've used that word today, and it's so exciting just to follow the energy from all the connection that was just happening. But I'm here, and I do represent the Academy of Oncology Nurse and Patient Navigators, but I'm really standing before you as a navigator myself today. And it's just a privilege when you have the opportunity to walk with someone in a cancer diagnosis. It's a very intimate experience. And so I want to just I understand just hearing from you today that many of you had a patient navigator. Many of you are survivors and had that experience, and it was positive. But I also know that if I asked for a show of hands, many of you did not have that experience. And so I think as I come to you today, just thinking about, I've learned so much already today in our conversation, just again about the value of each of us having that navigator as we are going through that cancer experience. As the navigators are growing in their field, many times they started off as general navigators. Then they became more disease site specific. Well, now they're actually moving into the role of being a clinical trial navigator. So some of you may have even had that experience, but they're not many. They're really growing in our profession. I was so excited to hear Dr. Loyola and others talk about Penn State and Carmen Guerrera and her work around navigation. So again, it's really we need more data and we need more metrics around the value of navigation. So here you can see, again, the discussion historically, we've understood that navigation is valuable, but we don't always have the data that we need. We had a focus group, which I had to laugh. It would have been better to have been a gathering. It would have been a lot more fun. So I'm going to take that back. But we had our focus group in May of this last year, and we really had the opportunity to come before the navigators and find out, how do you feel about your role in the clinical trial space? And you'll find today that they were actually very like-minded with you. They felt that many times they're not included in the discussion, that they're not brought to the table along with the other members of the healthcare team to be a part of that discussion. They agree with you and what you were saying, that many times clinical trials are not talked about with every patient. They're talked about at the end of the journey. And so again, that is something that we hope to mobilize the navigator and hope to correct and move forward on those. They really want to be a part of the strategy moving forward. Many times you will find that many healthcare systems are very fragmented. There's a lot of silos. And so again, navigators, they also see that with you and want to be a part of that solution. So why navigators? We understand that clinical trial navigators are growing. They're an emerging field. We know that the navigator can be one of the first people that patients talk with when they're diagnosed. Many times they are, if you have the opportunity to have a navigator, as you know, it's such an overwhelming experience. And so again, they've got you. And again, they're there with you at diagnosis, ideally. They're that constant, again, throughout the journey. And they are also very trusted as you are walking through that journey. One of the more important pieces I think that's overlooked in mobilizing the navigator in the clinical trial space is really being able to address all the barriers that we've talked about. They are not only able to address barriers of getting people to trial, many times they really understand that community, and they have those relationships with a lot of the community leaders. So hopefully, again, they can address that accrual and support for even understanding the trial. They also can support you at retention and staying in the trial. As we talked about, there's a lot of financial obstacles, but many times those can be gas-related, childcare-related, as we've talked about earlier today. So again, they can come along and hopefully address those barriers to keep the patient within the trial. There could be side effect management, adverse event management, and navigators can, again, help support that. So again, I hope that we're part of the solution as we are talking about the value of the navigator. And we at AONN, we are really being intentional about this discussion and wanting to leverage the role. And so again, very excited to be here with you today and just, again, to be a part of the collaboration as we move forward. Thank you.
Thank you.